Hello, hello. Hey, gang, Dr. Anthony Mazzarelli, my initial intern when he was both a law and med student, has selected the provocative Friday poll question. And I got to get in on this. First, let me tell you the college football playoffs are off and running. Exciting, right? And the pro football playoffs are not far behind. Whether your team scores or not, there's always another way to win on the Play Gun Lake online casino and sportsbook app in Michigan or the BetParks app in Pennsylvania, New Jersey, and Maryland. BetParks and Play Gun Lake, the only apps that I ever use and recommend to bet sports and play all your favorite casino games for real money. Get some skin in the game and bet sports or play blackjack, craps, poker, roulette. You can do it during the downtime in any of the games. So double your pleasure. Make your downtime fun time is what I'm trying to say. And check out those hot online slots based on the movie Ted or Rocky or the TV shows Peaky Blinders or Breaking Bad. More fun stuff. New users download the app and get up to $1,000 casino bonus back if you're down in the first 24 hours. Your casino bonus has to be wagered. The playgunlake.com or betparks.com locations are where you want to go for all the details. Got to be 21 and in Michigan for the Play Gun Lake app. Got to be 21 and in PA, NJ, or Michigan for the Bet Parks app. Gambling problem, call 1-800-GAMBLER. Okay, so at Maz's request, I was going back and forth with Maz and I said, what would you like the Friday poll question to be? And he said, how about, do you trust doctors to prioritize your health over profits? Maz will have his explanation on the Friday version of my program. And by the way, as a physician and co-CEO of a major hospital healthcare system, he will have an informed view. Mine is more visceral. I said I want in on this action, so here it is. I don't demonize doctors. I don't think as a group that they prioritize profits over patient care. So there's my answer in a nutshell to the Friday poll question. By the way, nor do I, as a former trial lawyer myself, nor do I demonize the trial lawyers. Remember when it was the trial lawyers and everybody said, oh, they're single-handedly driving up the cost of health insurance? No, I don't think that either is the case. I think that each, physicians, trial lawyers, by the way, healthcare insurance companies, they're all just spokes in a very complicated wheel that collectively comprise a very disjointed healthcare system, a very, I'll say, disjointed and dysfunctional. I'm eager to talk about this subject, but still in the aftermath of the assassination, and that's what it was, of the healthcare insurance CEO, I'm just treading on eggshells because I don't want that individual to be rewarded. I don't want his conduct to be rewarded. And by the same token, there's a valid conversation here to have about what's wrong with our healthcare system and how it can be improved. As a matter of fact, Andrew Whitty is the CEO of the parent of United Healthcare, which was the insurance company whose CEO, Brian Thompson, was executed on 54th Street by now, 3.5 going on 4 weeks ago. And he wrote an opinion piece for the New York Times in the aftermath of that death, where he tried to enlighten and make sense of the bigger picture issues. And I noted a paragraph that Andrew Whitty wrote. He said, we know the health system does not work as well as it should, and we understand people's frustrations with it. No one would design a system like the one we have, and no one did. It's a patchwork built over decades. Yeah, how did it get this way? It's a rather unique system. And in the United States, it's one that ties health insurance to employment, rooted in the model coming out of World War II. Because during World War II, the U.S. government implemented wage controls to curb inflation and to manage a wartime economy. And so one response to that was that employers were restricted in how much they could pay their workers, but to get around the wage caps, they began offering non-monetary benefits, including health insurance. And that then took hold because during the course of World War II, and no, I'm not just spitting this off the top of my head. I knew this was the case, but I went back to assure myself of the origin of this. And I know that during the course of World War II, the IRS ruled that employer provided health insurance would not be taxed as income for pardon me, employees, which made employer sponsored health insurance a tax-free benefit. And therein was the model born that carries over to today, fueled, by the way, by the fact that after World War II, the US experienced economic growth, and unions, much stronger than they are today, prioritized healthcare benefits in their negotiations with employers. It's a rather unique model. I think Japan is somewhat similar, but you'd be hard pressed to find some other country around the globe that does it the way that we do it. And as I've said on radio, one of the problems that I think comes from this system is that we, the consumers, are not really the clients, right? We're the end user, but it's the employer who has purchased, in many instances, that insurance that is the client. That's probably a better way for me to say it. And we, who are the end users, we don't have any bargaining power. Everybody gets insurance, largely through employers. Obviously, if you're older, Medicare, Medicaid, public assistance, and so forth. But that model carries over to it today. And I think it's problematic and needs to be reinvented, which I guess is one of the reasons why, in the abstract, I appreciated what the Affordable Care Act was trying to do. The Obamacare model, where theoretically you can remove employers from the equation, where everybody gets in the pool. Everybody has to have healthcare insurance. If everybody is in the pool, we are drawing on the contribution of young invincibles. And that allows us to provide healthcare insurance for those with pre-existing conditions. I mean, that's how it all levels out. And I always thought it was kind of nutty to call that socialist. I never understood the people in the Tea Party in their protests, raising Gadsden flags, "Don't tread on me," and clamoring for what? The right to be uninsured? Knowing that in this country, we can't turn you away from the ER. If you show up, insurance or not, you're going to be treated. Socialist to me wasn't the Affordable Care Act. Maybe it's a description of some elements of single payer where now you've got a centralized system and a government-run agency that is responsible for the delivery of insurance, although with private hospitals and doctors, so not exactly a socialist model either. Canada. I mean, I don't think of Canada as being a socialist state. They've got it. Whether it works is a matter of debate. But I'll say it this way. I'm more open today to single payer than I ever have been at a point in the past. I just don't know how, if the country was so vociferous in opposition to the Affordable Care Act when it was coming online, we could ever get this done. But what I see from a consumer standpoint, and Maz may have something to say about this, is such a fragmentation in the marketplace where those who can are now paying regardless of what health insurance might afford them. They can have health insurance and they're still paying a concierge doctor, so they've got the opportunity to be seen immediately. And you've got so many physicians and providers, particularly when it comes to mental health, who are going toward a cash and carry model. And what's the result? But many can't find doctors who will take their coverage. There was a story. I'll explain it this way. There was a story within just the last 2 or 3 weeks. I had it in the newsletter. I think it was from NPR. Don't hold me to that, but this stands out. It was a reputable source. Well, actually, it was the American Medical Association cited in this news story that caught my eye, behind the statistic that a third of psychologists today are not accepting insurance, are not accepting insurance. So in the area of mental health, despite the fact that federal law requires insurers to provide the same level of access to both physical and mental treatment. It's just not the case. And it's not the case because they don't think they can make money on the mental model the way they can on the physical model. And you've got just deserts. You've heard of food deserts. You've now got coverage deserts where people in the midst of a mental health crisis just can't get the treatment that's necessary. Meanwhile, we have Democrats talking about a single payer system as an alternative or expansion of the Affordable Care Act model. And I have no idea what Donald Trump envisions. He doesn't want to have anything to do with anything with Obama's name in it. But I've just never, and I pay attention to this, I've just never heard explanation of a cogent alternative. Okay, if Republicans aren't for the Affordable Care Act, and if Republicans aren't for single payer, then what are they for? I don't know. All of which is not exactly an answer to today's poll question at Smerconish.com, but I gave you my answer. I don't demonize physicians as a group and hold them singly responsible for the woes of our healthcare system today. And I don't believe as a group they prioritize profits over patient care. Some, sure, in the same way that some trial lawyers, are not good for the system either. But I'm not going to demonize either profession generally. I think what's necessary. I wish I say this not with tongue in cheek. I say this in a serious way. I wish the intellectual capital that is apparently about to be brought to bear in the first 100 days of the Trump administration to reduce federal spending, DOGE, the Department of Government Efficiency. I wish that similarly bright people were being brought together to rethink and reinvent our healthcare model. Because I think the entire slate needs to be wiped clean, and we need to think fundamentally about how we're going to provide health insurance for all and do so in the most economic model possible. Too many physicians today, and I believe it, are just saying that it makes no sense financially or time-wise for them to be participants in the healthcare insurance model that we have today. And those who can get out of it and go cash and carry, they do. And patients who can afford to pay physicians, they do. But a whole host of other people, particularly those in need of mental health treatment, are getting cut out of the system. It's just not working. It's just not working. Hey, thank you for listening. It's the Friday poll question, and I wanted to be heard on this. I wanted to have something to say about it. There was no way I was going to let this pass me by. So for Friday, December 27, 2024, I thank you for listening. Go vote at Smerconish.com on the Friday poll question.